Hello, and welcome to the kickoff webinar for the Supporting Healthy Start Performance Project. Today, we will have a welcome from the Division of Healthy Start and Perinatal Services by Dr. Tiffany Wiggins. We will then have introductions of NICHQ and the National Healthy Start Association by Ken Harris, Senior Project Director at NICHQ, Deborah Fraser, CEO of the National Healthy Start Association, and Kelly Devlin, Senior Project Manager at NICHQ. We'll next go into an overview of NICHQ's approach to the Supporting Healthy Start Performance Project with Ken Harris, and then a review of the technical assistance request process with Kelly Devlin. We will then open it up to your questions, and we will answer as many as we can during the segment. If we do not get to all the questions today, we will send out answers following the webinar. Thank you very much for your time.
With that, I would like to introduce NICHQ staff as well as the association staff, and we're really happy to be partnering with the association as NICHQ is the prime on the grant. It's exciting to be able to work with the association as a subcontractor for NICHQ to execute on specific deliverables on the grant, and so we're excited. Our intent is really to leverage the NICHQ's resources and to help and contribute to lead to successful implementation of this grant working in partnership. And so Dr. Scott Burns, who is our president and CEO, is unable to be on our call today, but I certainly represent him and sharing his excitement and the pleasure it is for us to be working on this particular cooperative agreement with Healthy Start and partnering with the association. And so I give you greetings in his absence. But at this time, I'm going to ask Deborah if she would introduce the staff that will actually be working under subcontract and this agreement to execute on some of the deliverables around the fatherhood piece, conference meetings, our mentoring program, as well as the CAN. So Deborah, if you would go ahead and introduce your staff.
Thank you, Ken. And they're on the call, but we're going to keep this call moving. And they're on the call and they're on mute. And thank all of you grantees for being on the call and for your continued support of this effort for technical assistance and support that will help us to improve the Healthy Start performance moving forward over the next couple of years and build on the work that we've already done. We're contracting right now with Ken Scarborough, who I think many of you know already. And Ken is working with us on the fatherhood work. And then we have working with us Brandy Payne. Brandy is working with us. She's worked with us before on our conference and our summit. And Brandy is working with us as a program coordinator. And then we'll be hiring a program manager in the very near future, in the next couple of weeks. So we look forward to that hire, and that will complete our team. And then Dr. Art James is working with us as well on issues around maternal health and equity. So that completes the Healthy Start team at this point. Thank you, Ken.
Yeah, thanks, Deborah. So I'll ask
Excuse
Kelly.
me, Ken?
Yes? Oh.
Hi, I'm so sorry. It's Vanessa. I was able to fix the mute issue on our end, so I apologize for interrupting, but I do have Dr. Wiggins with me whenever we can slip back in. Thank you. We see the slides.
Back in already, so.
Sorry about that, everyone.
Not a problem at all. Go right ahead, Dr. Wiggins.
Great, thank you. Everyone can hear me, I hope. Good afternoon and welcome everyone. This is Dr. Tiffany Wiggins. Some of you may remember me as Dr. Tiffany McNair. A lot has happened this summer. You kicked off your Healthy Start cycle, and I also got married. So now you can refer to me as Dr. Wiggins. Thank you so much for your time today. We know that you're all very busy, and so we appreciate your joining this introductory webinar. This is just one of several opportunities that you will have to get to know our new awardee for the Supporting Healthy Start Performance Project. The division is excited to be working with NICHQ and its partners to provide you with the tools, the technical assistance, and the capacity building that you need that will take your programs to the next level of excellence. We're humbled by the work that you do, And we're proud of the achievements that the Healthy Start sites have been already making and will continue to make in this new grant cycle. We want to continue to support you and do whatever we can to ensure your success, and we know that NICHQ and its partners will do the same. In the coming months, please let them know what you need, what's working well, and what can improve. We really do want to hear from you. As you'll see in a minute, and you've already actually heard a little bit already, the NICHQ team is poised and ready to begin assisting you as you do this hard work on the ground of reducing infant as well as maternal mortality and of eliminating racial and ethnic disparities in perinatal health. I know there's a lot to cover, so I don't want to take up too much more of your time, but again, just want to say thank you. Thank you to all of you. Thank you to the NICHQ team for joining and conducting this webinar. We look forward to working with all of you in the coming months and years. So I'll turn it back over to you, Ken. Thanks again.
Thanks so much, Dr. Wiggins, and congratulations again. So I want to pause, and I feel like we've reset. So I was really taken that our technology acted up a little bit. So I really want to thank everyone, Dr. Wiggins, you and your team, as well as all of our Healthy Start grantees. Thank you for your patience with the call thus far, and I believe we're all set now. And so I've had a moment to pause because I was like a little kid excited to we were excited to greet you today, and we've been doing a lot of preparation for this call. And so to have that glitch hiccup at the beginning, I felt like a little kid that got disappointed after waiting for the dance for so long. So I just ask as we continue this call, I hope that we're able to pull up that excitement that we had to keep us kind of excited and hopeful about the next 5 years of working with you, and ask that you just extend us grace with that. And so a couple of things I got thrown off and didn't say, but it's really the excitement to be at NICHQ after being a project director at a local site for many years. And this is a great opportunity, and we're happy at NICHQ to be leading the effort, and as I said, working with the association. And it's a new role for me. I had a lot of fear coming here because NICHQ is an awesome organization, and they utilize a lot of technology. So my big fear was around technology, so I'm not surprised that today happened for me, but I'm okay with it because we've addressed our fear. We're going beyond it. So at this time, I want to go back and just continue on to introduce this wonderful staff. And my immediate support is Kelly Devlin, who's our Senior Project Manager for the Supporting Healthy Start Project Performance. And I'm going to ask her to talk about her role a little bit and then introduce the staff that's part of our immediate team here at NICHQ. Kelly.
Thank you so much, Ken. I'm really excited for this opportunity for us to meet with you all virtually, and look forward to many more opportunities virtually and in person in the coming years, hopefully. So my role as the Senior Project Manager for the NICHQ team is to work closely with Ken to make sure that the team on this slide is coordinated to accomplish the vision for the TA Center as determined by our project leadership through our cooperative agreement with the division. So to my right on this slide is Tess Pritchard. Some of you heard from her already at the beginning of this webinar, although I know there was a lot of difficulty with the audio, so maybe you didn't get a chance to hear from her, but she does manage the Healthy Start at NICHQ project email account and the calendar. So Tess is really the main point of contact for all of you, and she has a large role in coordinating all of our activities and communications with you. And to Tess's right is Emily O'Donnell. She's the senior analyst on our team and will be leading the evaluation activities for the TA Center. So that will include analyzing what we learned from the evaluation activities and making recommendations to improve our work to best serve you. We will also have a couple of other NICHQ team members joining us in the coming weeks to round out our team. But I know I can speak for all of us that we are really honored and humbled to be doing this work alongside you, and can't wait to meet you all in the coming years and weeks.
Thanks so much, Kelly. And now just to get into the purpose of today is really to share with you our approach to supporting Healthy Start. And as you heard from Dr. Wiggins and others, we're really excited for this opportunity and excited to be chosen to actually do this work. It's a great opportunity for NICHQ to really share our approach around technical assistance and the capacity building assistance with you today. And we really want to take this time to emphasize the many resources that are currently available on the EPIC Center website. You will start to hear more from us after this call as we're working on developing a survey for project directors, and even presently we're coordinating calls with POs to understand from their perspective some of your needs and any assistance we can offer you now. And so all of this is just about assessing your needs and positioning ourselves to respond to those. So we'll not only solicit your help, but we need your help in order to be successful. And so we really want to invite you to be engaged with us now and over the next 5 years. With that, it's important to understand the project structure here, and so this slide is to do that for you. So as HRSA MCHB has funded us, and our project officer is Vanessa Lee, and many of you know Vanessa Lee. She's our project officer for this cooperative agreement. And then the lead organizations that you've heard, it's NICHQ, and then our subcontractor, National Healthy Start Association, and then Deborah as our co-principal investigator along with Dr. Scott Burns. And then under that, you've met some of us today as our project management team, and then there's an evaluation team that's kind of going to be doing the do, if you will, to execute on the technology transfer and information, as well as providing the training and technical assistance, which will be offered at 3 levels. Training that will be available for all of the 100 grantees, and then we'll be establishing groups for those smaller subset of grantees that have common interests or topic area or challenge areas. And then last level is really on individual, kind of that one-to-one requested through the EPIC website. And this next slide is just to show you a little bit more detail into how the flow is, but just to see the actual supporting Healthy Start project performance staffing, which you've met all of us as from the director on down to the analyst, and then the blue shows you the staff that's hired at the association. And so looking at your kind of immediate team, that'll be responding to the TA as well as the capacity building assistance. And again, working together to support technology transfer and information, which many of you have been accessing the website and seeing and engaging with some of the offerings there. And so our work around continue to build that up and make it of use and service to you. And then also some of you have also started requesting some assistance, and so identifying training and other technical assistance needs. And then if we're successful, not if, when we're successful in doing those two, it really leads to, as you look at the bottom of the screen, the increased capacity of Healthy Start programs to implement, align, and really measure effectiveness of service delivery. And so, as you may know, NICHQ is known for quality improvement, and not only NICHQ, but we plan to work closely with many of you who have been doing this work for some time and honoring that work and building off of not only the last 5 years, but Healthy Start almost 30 years now. And so really doing a great job of demonstrating the effectiveness, and so working closely with you all as well to improve outcomes and health and well-being of women, children, fathers, families, and communities. And so for us, when you look at this as a level, the top level is kind of the head, those that think about and have to do the strategic planning and visioning, but then as we work through who's doing the work, that's kind of the hands of the project. And then the heart of it is really getting to the work that you all are doing locally. And so it's just helpful to see how this plays out. And again, for us, it's about providing service to the division and to each of you as grantees to really have this greater impact across the country, even at the local level, and having great impact in your local programs. So with that, the Division of Healthy Start and Perinatal Service continues to fund the EPIC Center, which we've been working on and will continue to work to improve, to provide you with training and technical assistance. So again, lots of resources we'll talk about a little bit later, but we thought it'd be great to kind of give you a intro into that website. And so we'd like to take this time to show you that video.
The Healthy Start EPIC Center is a national training and technical assistance center operated by JSI with funding from HRSA. We provide training, consultation, and technical resources to community-based agencies working to give every child a healthy start. Healthy Start grantees can register for training opportunities and access technical assistance and many other resources through our website, healthystartepic.org. The Healthy Start EPIC Center team is located throughout the United States. You can learn more about the team and our visions for maternal, child, and family health in the EPIC Center staff section of the website. Our website homepage is a quick stop to find out information on upcoming webinars access to evidence-based practices recently added to the inventory, and our contact information. From the homepage, you can also navigate to each section of the website. Under the Healthy Start tab, you will find a program overview, grantee map, and information on the Healthy Start coin. Under the Healthy Start Implementation tab, you will find information and resources related to the Healthy Start screening tools, approaches, and monitoring, data, and evaluation. Under the Training and Events tab, you will find the training calendar, catalog of recorded webinars, information on regional meetings and community trainings, peer learning opportunities, our breastfeeding initiative, alcohol and substance exposed pregnancy prevention initiative, and the online Healthy Start Community Health Worker CHW course. The Healthy Start CHW course provides baseline introductory training towards the achievement of perinatal health competencies and core competencies needed to fulfill the roles and responsibilities of a CHW in the Healthy Start program. This online self-paced course was designed for CHWs and is open to all interested Healthy Start staff. Under the Resources tab, you will find outreach tools, the Evidence-Based Practices Inventory, a list of MCH organizations, Project Director's Guide, and Project Management Hub, the Healthy Living Initiative, and information on maternal mortality prevention. Evidence-based practices include actions, activities, strategies, or approaches that improve the health of women before, during, and after pregnancy in order to improve birth outcomes and give infants and young children a healthy start. You can search for a specific evidence-based practice using our search bar or filter the inventory by topic, perinatal period, and resource types. Under the HS Staff Roles tab, there are pages highlighting each of the common Healthy Start team roles and resources related to peer learning opportunities. The Healthy Start Epic Center provides for free, in-depth technical assistance, also referred to as TA, that is tailored to a grantee's unique needs, contexts, and environments. You can request TA through your TA coordinator, project officer, or using the TA request form. To keep up to date on upcoming trainings and new resources, sign up for our e-newsletter. The Healthy Start Epic Center looks forward to supporting you in your important work serving mothers, fathers, infants, families, and communities.
And I'll just move right along to the opening page that folks will get, which is in the website. The address is at the top, healthystartepic.org. And when you go to the website, this is kind of what you'll see when you get there. And there, right up front, is a tab and button to request technical assistance. And so Kelly's going to talk about that a little bit more later. But what I would like to do now is just to go through a few of the points on the website, which I think are really important and have lots of resources that we want to make sure that you're accessing now. Lots of the requests, emails that we received since beginning this project with you are centered around some of the resources that are actually here on the website. So we actually think that the website is a great resource for folks to tap into now, and especially many of you are new, you may be new staff or a new project, and there are lots of resources there that we want to point you to today. First, looking at existing resources, so when you go into the Outreach and Education Tools section, you'll see actually recently uploaded behavioral health brochures, in fact, that are ready to use. There's an online version as well as a print version, and usually that's what you'll see when we get new materials to upload. But just go to that particular page, and there's lots of other resources that are there. And if you look to the left, you'll see other sections, evidence-based practices, MCH organizations, as well as the Project Director's Guide and Management Hub, and some other resources through those tabs. And so just going on, also we've sent out a newsletter recently, but the e-news, we're going to kind of revamp that and reintroduce that at a later time as we work with you on designing it and just to add some features to it so to be even more helpful for you. But the e-news will be places where you can look for tips, tools, and training. And again, we've recently sent out our newsletter, which was our first attempt at connecting with you through e-news. And so we'll continue this and also engage you, as I said, in designing it and making sure that it's useful for you when you do receive it. And many of you responded, and this newsletter, we actually had a little contest around the tagline. And so I'm going to ask Tess if you could tell us the results of that.
All of you is strengthening Healthy Start to support family health and well-being.
Okay, so strengthening family health to support family well-being.
Strengthening Healthy Start, yeah.
All right, so we're excited that that's something we've done together already, and so we'll use that as we continue our communications as a collective tagline that we've all agreed to, but strengthening Healthy Start to support family health and well-being, which is what we've been about. So the newsletter will continue to come and have again, connections to trainings, webinars, and other things that we find out about. And if you know of any of those things, please share them with Tess, and we can get those things published as well. We really want to push you to look at the inventory of evidence-based practices, because many people have been looking for curricular, et cetera, that's evidence-based and as far as practice and curriculum. So that website, when you go and you look to the right, you'll be able to filter by topics, and everything has been organized for you, and also rated as far as its level of evidence-based. And so that's rich resources are there, and topics such as breastfeeding, depression, health equity is even there, and I know many of us are zeroing in on that for these next 5 years, and home visiting. So lots of topics are there, just a wealth of information that is there with regards to evidence-based practices. So as your continuing programs are starting up particular focus areas, there's a wealth of resources there under the evidence-based practices. And knowing that we have 25 new Healthy Start family members, and also for existing projects that may have new staff, really want to point you to the project management tools that are found under the Project Director's Guide and Management Hub. Again, very useful tools are there. It's a great way to orientate your new staff that may be coming, your managers, and various areas of management when it comes to this Healthy Start program. So that is super rich in information, and certainly would be useful for staff and management staff in particular for this grant. And so we point you to that site to get those kinds of tools that are there. And one that I like and I've used before, and that's the staff development packages. And so many times you hire staff that are, are going to be great, but they need some support on particular areas. And so this is a great resource for providing trainings. And most of the trainings are less than an hour, so staff are able to kind of have an online engagement for about an hour just to develop and maximize some skills. And so, again, directing you to that, because a lot of folks have asked, how do I support my staff in this area or that? Well, the staff development packages that are there are really useful. And so we point you to that particular area and to the website as well. And many of us, we know about the screening tools that have been developed, and the most recent ones are posted on the website. So with regards to performance resource sheets, the screening tools are there if you need them, and other resources are there to support those screening tools. And so that's where you'll find the screening tools. The latest ones are there. So that's a page that everyone will be into. I also want to spend just a little time on the community health worker course, because we find that many people have been utilizing the community health worker course as folks are focused on that at this time. And so I want to encourage you, if you haven't, to certainly check that course out for your staff. And I'm going to have Tess talk a little bit about the challenges that we know some people have, but that are a remedy to the challenge that she's been experiencing thus far from folks.
Hi, so once you've registered for an account on the Epic Center, you should receive a acknowledgement of your registration within the day. If you don't, feel free to go ahead and email me at healthystart@nichq.org. We've had some instances of people not receiving their request acknowledgement, as well as being able to reset their password. So once I know that it's a problem, I can go in and reset it for you. We can get you access very quickly. So just feel free to reach out to me if you're having any issues at all accessing your account.
Okay. So yeah, so if you have any challenge, feel free to reach out to her immediately. Sometimes people try to work it out and re-register and those types of things, but if you give Tess a call, she can resolve it fairly quickly for you so you can access that course or certificates or what have you. But again, a very rich resource that's there for your community health workers and a training that, you know, should encourage them to take advantage of. So we really want to spend some time talking about requesting TA and how you do that and what happens once you make a request for TA, and then also how do we resolve those. So I'm going to ask Kelly if you would take us through that process so folks will have an idea and exactly, not just an idea, but they will actually know how to request TA and what will happen once they do.
Absolutely. So a big focus of our first couple of months was ensuring the smooth transition of the existing website along with all these resources that Ken just described to NICHQ. So part of this involved developing a new TA request form, which is now live and should look very similar to what you're used to if you've used the TA request form on this site in the past. But the main difference now is that it will connect you to us, the new TA Center team. So from any page of the Epic Center website, there's a link at the top of the page where it says Request TA, so you can see that circled in red on this slide. Clicking there will bring you to a form that will ask you to fill in the information that we'll need in order to process and track your request. So once those forms are submitted through the Epic Center website, my apologies, we receive a copy of each of those forms directly to the Healthy Start email address. So Tess receives those, and our goal is to acknowledge receipt of those forms within 2 days. We'll address the TA requests that we can right away, and for those that we aren't able to answer right away and would involve more of a work plan to address, we'll work closely with you to determine the most efficient way to address your request. And we, along with that, we commit to keeping your project officer informed as part of this process.
Okay, thank you, Kelly. So again, it's important to share with, to talk with your POs about your needs and your requests for TA, so they're aware of those. But just know that once they get to us, that we would also reach out to the PO just to make sure everyone is included and understanding what's happening with regards to this specific TA. And so I think that's an important piece. So again, utilize the website to do a formal request, but it's also important to talk through some of those requests with your project officer and get direction there as well. But we certainly will follow up and keep everyone in the loop. So you'll see in the future, we'll share the processes with you so you'll understand exactly how TA will be tracked and how we'll follow up and follow through on each and every request. It'll be clear for you what stage of development or process we're in with regards to delivering on the TA as well. So all of that's forthcoming, but we wanted to get you started on making those requests formally through the website. We know that a lot of folks have made some of their requests through the email, and we've been responding to those, and we'll continue to do that. But again, if you have specific needs around technical assistance, make those requests through the site. And again, that new form is very important because there we ask not only for your name and your role within the project, but also who the project officer is. That makes it easier for us to make sure that everyone's included in those TA requests. So at this time, we want to move to questions. And I know that in the beginning, Tess explained that we'll be utilizing the chat box today. And so because there's such a large number of people on the call, we're not going to open it up for questions necessarily. But we would like to ask you to use the chat box with your questions, because we will be reviewing the chat box notes. And so when you put your question in the chat box, just make sure you have your name, the name of your project and the city, and then also your project officer. So that way it'll be easier for us to follow up with you. And if you want to include your email, that's helpful to have right there as well. So we'll have to look that up later. But just any information that you can put in about yourself and your project, and then your question, and we'll be sure to follow up with you with an answer. That's part of what we're committing to do with this introduction webinar today. We knew we wouldn't have time to go into a lot, but we certainly want to get your questions. And so please take time to do that now. There were a couple of questions that we feel that we've responded to in today's webinar, and one was providing the webinar and to talk about the website, because a lot of people have asked for different resources, and so we're pointing you to the website just to help meet some of those immediate needs around looking for evidence-based tools, toolkits around interconception care, preconception, or behavioral health. Those things are there. Those that are new have asked also about the screening tools. And again, we've assured that the screening tools have been updated and available. So that's a good place to start and checking out some of the resources there. And again, I apologize we didn't have the introduction of the webinar, but again, when we send that link to you, that'll kind of share with you some other features that are in the website. Look for the website to be updated often. We're going to utilize that banner because we heard from many of you that the banner is useful to see when you go to the website. So that's where we'll have quick alerts and updates you'll see as soon as you get into the website. And so we hope that you will get in the habit of checking out the website often just to see what's happening, because Tess is really committed to making sure that we keep that updated almost on a daily basis. So answering the question, how do I request TA? We've answered that today. Who is going to follow up and what happens once that request gets to NICHQ? We feel we've answered that today, and that is Tess. Tess is responsible for monitoring those and getting those to the appropriate staff, and we at NICHQ will follow through on each and every request. With that, I want to talk a little bit about communications. And again, NICHQ is happy to serve in this role on this cooperative agreement, and we're really your center. So if you have questions, concerns, or anything related to this cooperative agreement and the work that we're doing with regards to technical assistance or capacity building assistance, just reach out to us. Again, through the website, through the Healthy Start at nichq.org, or you can reach out to myself or Kelly. But the NICHQ is your center, and we want to kind of create that over the next few years, that you understand that we're the center and certainly want to be able to respond to the needs that you have. We're going to commit to ensuring that communication is happening across all levels. We're working closely with your project officers. We want to get to understand each and every one of you and your specific needs. And so talking with your PO, talking with you, meeting you at meetings, asking for your feedback is something you'll hear from us a lot, because we want to make sure we understand and that we're able to respond to the needs that you have. So communication is really important. But just so you know, we're your center, and we're here to serve you here at NICHQ. So again, any requests you made, we'll connect with the project officers to make sure they're aware, and then we'll work together to come up with a plan, how to address the particular need, and then we'll do the follow-through. And then, of course, when it's completed, we'll share that information with the PO as well. So think of us as your center, and your direct communication can come here, and we'll serve you and the division in this cooperative agreement. And if communicating with your POs, know that NICHQ would look forward to connecting with your POs on all communications. So with that, we should do a good job of keeping everyone in the loop, and I think that's our overall goal, is just to make sure that we're working together. So with that, we really want to thank you for today, and I apologize again for our technology challenges. Stunned a little bit. We practiced a lot, but it didn't go as well as far as the execution. But we do hope that you're excited about this website and the resources that are there. We know that folks, you've started since April 1 and you have some needs. So again, if you utilize the website, we're ready to receive any requests that you have now. As I said, we're talking with POs now, and from POs, I want to say we're looking forward to understanding the needs of your particular projects. And then, as I said, in the coming weeks, our project directors will receive a survey that will ask more directly areas of need. So if you want to share those now, you're more than welcome to do that. But we are creating a survey that will actually get to those needs, and we'll do a complete needs assessment to come up with themes so that we can move forward on this cooperative agreement. So thank you, and we're excited to be working with you. And for myself, many of you, I know some of you in my many years of being here, but I'm looking forward to working with you as the director of this Supporting Healthy Start Performance Project. So with that, I want to thank you, Dr. Wiggins, and thank all of the project officers that are there at the division and the support that you provided to us as we work through getting this cooperative agreement going. And we're looking forward to building that relationship with each of you as project officers, and then also to the 100 sites, directors, coordinators, case managers, all of you out there. We're looking forward to working with you as well. So thank you for joining us today.